Thank you very much. And I'm going to present what Uganda has been able to do since the start of the pandemic. Having served on the Uganda Scientific Advisory Committee for COVID-19 since the breakout, I've been involved in the day-to-day planning and implementing, and I was the lead modeling consultant for the committee that is currently, it is still active. Currently, Uganda has about 53,961 cases. Of those, we have 383 deaths and 47 and 760 recoveries. At the beginning of the pandemic, when the committee was, when the Scientific Advisory Committee was set up, we had numerous objectives. We had to come up with a model that will help the government to plan based on evidence, like data-driven policies. So we had a lot of objectives, but among them were to design a model that conformed with the strategies, the mitigation measures and non-pharmaceutical interventions to COVID-19 that the Ministry of Health had implemented. We had to determine the growth factor and replication rate of COVID-19. We had to predict, project, and forecast COVID-19 using models and daily cases from the Ministry of Health. We had to estimate the death, the recoveries, the bed capacity required, vaccination percentages using the Ministry of Health data, although at times we used the WHO data. We had to predict the coverage rates for NPIs required to reduce the reproductive ratio to below unity, and to estimate COVID-19 risks associated with age, gender, schools, bars, churches, and geographical locations. So all these were just among the many tasks that we had. And at the beginning, the first case in Uganda was on March 21st, and we were closed down on April 12th in a complete lockdown. And we remained closed until May 9th, when there was a phased lifting of the lockdown. Between the lockdown and the phased opening, we had almost no cases reported, no daily cases reported until when there was a phased opening of businesses and other services to the public. At the moment, we're in the second phase. Since the phased opening of the many services, people relaxed because there was no cases reported. At times, we would go for a week without a case. So they relaxed. They were not wearing masks. There were not social distancing. There was no hand washing. Now we are currently in the second phase, and recently the schools were closed. All government learning institutions were closed again on June 6th. So we are now in a phased lockdown with so many churches, bars, saloons, so many facilities closed down. Can we go please to the next slide? So right now we have updated the original model we used at the beginning, but we are still using the same approaches. We had to design a model that predicted the cases using transmission factors governed by the cumulative number of cases and the implemented NPIs. So the model that we designed and used since April 2020 was incorporating the NPIs at specific percentages as implemented by the government. And then using the cumulative cases, then we would forecast the cumulative cases reported daily. Then we estimated the costs for implementing the NPIs as compared to lifting the lockdown. And then the cost utility analysis. We had to determine the cost-effective analysis and optimization of these NPIs in comparison to the lockdown. How much would government have to invest to control, especially the thresholds, to control the daily numbers to below unity? And at what cost would it be to the government, incorporating all the other costs that they were incurring? Next slide, please. So at the beginning, there was tests, daily tests. There was random tests, contact tracing, alerts from people in the communities. So we had tests done every day, and we would determine the positive cases daily. And you can see that beginning the phased lockdown, when they started opening, the cases started going up. From March to around May, we almost didn't have anything. We hit 100 around July. Then since the opening of these services that were locked down, we started seeing high numbers. And then around March 2021, almost nothing. And now we have the breakout that every day we have almost 1,000 cases. And these are the cases that report to the hospitals. There are lots of people who do self-medication. They do self-diagnosis and self-medication, so they don't report. So only these cases that we capture are the ones that actually report to health facilities. And at the moment, they only admit you if you're either severe or critical, because all the hospitals are now full. If you're mild, moderate, or asymptomatic, you're sent back to homes to do home care, unless you have underlying conditions. Then you can be retained. Underlying like diabetes, hypertension, asthma, you can be detained. Or if you're older, if you're above 65, other than that, you're sent home to do home care, because it is very expensive to keep them in the hospital, and the government was footing that bill. Next slide, please. So this is our current epic curve. And you can see the timelines from March 2020 to June 4th. We have now hit the highest peak as of June 4th. And on June 6th, when the schools were opened in a phased manner, we would have some classes go to school, they return home, then the others at home go back to school. But apparently it has also not worked, because we have so many cases. I picked mine yesterday, but all this morning, since yesterday evening and this morning, we have been in the hospital testing, because they had a lot of symptoms, the cough, the flu, the pains. But so most of the hospitals currently are full with school children being tested. So at the moment, we have locked down the schools again to try and bring these numbers down again, because at the beginning, it appeared to work until people relaxed. So now we are seeing the second phase, and it is going to be a blowout. And we were locked for 42 days. So I hope it can cut down the numbers. Next slide, please. So during the previous one, please. During the 2020, because there were pending campaigns, many people made COVID a political issue. Many of them argued there was no COVID, that the government was trying to take the money. So we tried to determine how the misinformation in the public was affecting the disease progression. And we saw that indeed it did. Depending on how many spreaders were in the community, we could tell that the more numbers of spreaders, false spreaders we had in the community, the more infected we would end up with. So then government responded by reaching out to all these social media. They had a lot of communications trying to debug those misinformations that were going on. But even at the moment, some people are still arguing that there is a political force behind it. We've heard it was manufactured in China. It was meant to kill all the blacks. So this information is still circulating. But at the moment, people are believing that it is actually real, because initially we never saw anybody sick. We would just hear on TV, we found this number of cases. Then eventually we got to know the people who died. We could see the names. Now the people are in our families. You can know, I knew this person and they died of COVID, and this is how they were buried. So now they are putting cases to names and in families. People are now responding, trying to protect more. Most of the hospitals this morning have been full, people trying to test. So now they are responding. So at least the misinformation is dying out slowly. Next slide, please. So then we wanted to determine how many at the beginning of the pandemic, what was the coverage for social distancing? What percentage of the population was social distancing? How many were washing hands? How many times a day? How many were using face masks, regardless of the fact that government provided the face masks? And how many of them were social distancing? Then we wanted to determine if people, using the the rapid assessment survey that was done to determine how the percentage coverage of the different NPIs, we wanted to know with these coverages, what is the number of secondary infection from one infected person, and we found them out. Then we wanted to determine, using them as singly, at what percent should these NPIs be raised to bring the secondary infections to less than unity. So that we did. Then we wanted to determine if they're used in combination, hand washing and face masks, what is the secondary reproduction number? If so, at what percent should you raise both to have it less than unity? So we also did that, and using that information, then government would implement certain policies to try and attain these coverages across the population. And it also helped to keep the numbers down. Next slide, please. Then with pending vaccination, we started determining, based on the current cases, what we did when we are modeling, we categorized the cases. We knew we had the institutional quarantine, non-institutional quarantine. Then once you're in the institution, they would classify you according to the severity of your infection, either symptomatic, mild, moderate, critical, severe. So then we wanted, using those numbers for each category, we computed the R naught. So using those numbers and the respective reproductive ratios, then we determine the vaccine coverage is needed in case you have, for example, in case you have many severe cases. What is the reproductive ratio? It is this. What kind of vaccination do you need? Then we need this. So now the vaccination is rolled out, and we are trying to, and they know the percentages, they know the targets, although we are still quite low, only about 2.5% vaccinated and less than 1% for the second dose. But the people are responding now with this surge in the numbers. So we also determined the different vaccination scenarios. How much do we need to vaccinate to attain herd immunity, or to keep the numbers to less than unity? Next slide, please. So at the moment, we only have 706 by June 4th. Those are the only vaccinated individuals we had. Less than 1 million, that is less than 2%. But as of yesterday, we had hit 2%. And for the second dose, they are less than 10,000, because at the beginning, it was mandatory for the teachers, for the health workers, and for the people who are actively in service, the police, but still people did not really embrace it. But now they have responded, and now we see a high number of people being vaccinated daily. And we have hit, we are now above 2%. I know by the end of these 42 days, we shall be quite at high rate, and perhaps that they can also get the second doses. So this is where we are now, and they are bringing in some restrictions. Of course, they vaccinate you only when you accept, but if you're a teacher and you're not vaccinated, some schools have started sending out messages that it's okay, you don't have to vaccinate, but you'll not be allowed to interact with our learners when they return to school. And you can be a health worker, it's fine, but don't go to interact with your patients if you're not vaccinated. So they're kind of bringing in those restrictions. I don't know how they are going to affect those affected people, but in general, at population level, from the second high numbers and knowing people who are dead in different families, neighbors dying one after another, their children being sick, people have really responded. It's a bit hard to take this for them to respond to the NPIs, because the government of Uganda was among if not the best in Africa to manage COVID-19. And then people relaxed. That's when they thought there is no COVID. But now it has taken them to lose a relative or a neighbor for them to now adhere to the NPIs. So that's what I have been involved in. Of course, a lot of work has been done. The government gave a lot of money to Makerere University and other institutions of learning, about 13 billion, just to do COVID research. And the research output in the universities has gone very high because the government has really responded to the pandemic. It is supporting all the scientists. It is in every research connected to COVID. So we have had a high output of research on COVID. We've had people coming up with rapid tests. We have local hubs that apparently are working. They are trying to find a way to have those accepted by WHO. But if the government again restricts, as we did before, for people to implement the NPIs, I think Uganda will go back to the safe zone that we enjoyed for almost 1 year, with a few deaths and a few cases. And I hope that people can adhere to the mitigations because they have been proven to work, because they assisted for quite some time. So this is what I have been involved in personally. Thank you very much.